if patients have some control of their own money, let it be Medicare, Medicaid, commercial patients, then we will have a think about restaurant. Right now, the government or policymakers want everybody to have the same restaurant, same meal plan. But if everybody controls the money, guess what? Physicians like you might choose to have Michelin restaurant. You might choose to have McDonald's. We will have diversified provider offering to cater to diversified needs. And then the big restaurants, right now the hospital dominant, they're going to observe what's going on in the market and then they adapt. That is how small business, small practice drive innovation, drive the change. So I do think how to change this, all this system, right now looks like hopeless system, is to let people control their money. Once they can feel the benefit, they will stay, they will vote with their feet. And then independent practice will have a chance to innovate and to capture market share.
Yeah. So I want to talk a little bit about someone that I admire very much. I don't know if you've read any of the writings by Mark Bertolini.
I have not.
You should. Mark Bertolini was CEO of Aetna, okay? And he came into the health insurance market out of his own personal experience. So he almost lost a child to cancer. And then he had a traumatic injury skiing. And he was very passionate that you can make money and you can do good. And he realized that Aetna could not survive in this agglomeration of insurance health provider, health plans that was happening. He tried to merge with Humana, but it was blocked by the antitrust regulators. And then they turned Aetna into a retail store. It merged with CVS. And CVS won the better battle in the boardroom. So the CVS executives control Aetna. And CVS has now become, their idea was that they're going to enter retail primary care because they have a store in every community of the US and they could do it better and cheaper than anybody else could. And then they saw all the dollars coming from Medicare Advantage and they went full throttle ahead buying more Medicare Advantage providers and giving more incentive to Medicare patients to join the Aetna Medicare Advantage plan. And now they're up to a $900 million loss. And what happens in our industry when you lose money? We have a dear friend who is a consultant for pediatrician, and she says, when the health plan loses money, it starts looking for people to get haircuts. And it's not the hospitals and not the big groups, because they have long-term contracts with them and they can't do without the hospital. So they go after the independent physicians and they give them a haircut. Because now they're losing $900 million in the bucket of Medicare Advantage. They're going to make it up somewhere else. This distortion of the market is very harmful because, and I see their point. If I was a negotiator for Aetna with Dr. Rogo, I would say, you're willing to take $45 for a Medicaid patient for a 99213. Why should I pay you $46? Tell me. There's no reason. You can provide the care for $45 to a Medicaid patient. You can provide it for $46 for me. You don't deserve a dime more. And that's a totally reasonable argument. The problem with it is that they're doing away with the independent practices. And the premiums are skyrocketing. So before the pandemic, they were about $18,000 for a single individual in the private market, $28,000 for a family. Now it's more like $35,000 for a family plan. And if you really are going to pay $45 and there's no cost shifting, the independent practices can't provide the care. They're going to run, they're going to be out of business. Yep. And that's tragic. And as you alluded before, it is in the best interest of the big medical care organizations and the health systems to have no one else at the table but the two of them and raise the prices every year. That's in their best interest. What are your thoughts? Any ideas how we could change this narrative?
I think if we are the CEO of those large companies, either hospitals or insurance companies or other corporations, we probably do the same. We respond to incentives. I really, in my research, I don't really look at people's morality, etc., because that is on the margins, less important, in my opinion, as response to incentive, which is universal. So we have to have enough public awareness and political will to loosen the current regulations or legislative environment. That to me is the only way. Otherwise, if you, let's say this executive is doing something, you replace another person to respond to the same incentives. And also I look at hospitals, again, if I were CEO, I probably do the same, right? I would increase revenue, etc. When the position itself wrapped in that incentives will determine what the person in that position will do. So I would say improve the system instead of not only blaming individual player, because the incentives are wrong.
I give you that. If I was the CEO for it, I'm like, I'm not paying anybody more than Medicaid because they're willing to do the work for Medicaid rates.